Hey everybody, good afternoon. My name is Bill Ikest with the Georgia chapter of HFMA. We're going to give folks just a few minutes to get situated here. I can see the room filling up. We appreciate you joining us today, and we'll get started here in just a minute. Can you guys see that screen that I have up or no?
I don't see anything yet. Now we're in business.
Yeah. And I'll take that back. I'll stop sharing once we get started. I just wanted to show this screen. So well, good afternoon again, everyone. Thank you for joining us today. Today's Payer Forum session is presented by United Healthcare. My name is Bill Ikest. I'm a past president and active member of the Georgia chapter of HFMA and the moderator for today's forum. I want to thank all of you for participating and taking time out of your schedule. Hopefully this will be a valuable block of time for you today with the intention of coming away with some ideas and some updates and some solutions for some of the challenges that you might have as far as processing claims related to United Healthcare. I've got a list of facilities, organizations up on the screen. These are our current corporate sponsors of Georgia HFMA, and I just wanted to make sure that I took a minute to thank them for their support of the organization. A lot of good stuff going on at Georgia HFMA, trying to provide as much content as we can for our members. I'd encourage all of you to go out to the Georgia HFMA LinkedIn page, the Facebook page, as well as the Twitter and Instagram page, and like those pages so that you can get the latest information from the chapter. A lot of good information. We've got our first in-person event coming up May 5th through the 7th down at Callaway Gardens, and we look forward to hopefully seeing many of you. I know the interest and the attendance at the event has been great up to this point, so we're expecting a good crowd and some really good education. A lot of providers are participating in some of the sessions and the panels and whatnot. So today we have Coartis Murkison and Mark McQuistion from United Healthcare. Coartis is an advocate on the hospital side. Mark is an advocate as well, does some work on the physician side, but they're both here today. Coartis will be presenting, and they will be taking any questions that you might have. I would ask you to please put in the Q&A section any questions that you have as we go along. If it makes sense for us to stop them between slides and ask that question, we'll certainly do that. Otherwise, we'll be sure to leave plenty of time at the end for questions. Today's presentation is recorded. We also have their presentation that we will make available to you out on the Georgia HFMA website, and I will show you at the end of the session just exactly where you can go to access that. So without any further ado, I will turn it over to Coartis. Let me get the screen set here so that you can go ahead and share your screen, and we'll let you do your thing. Thanks, Coartis.
You are welcome. Thank you. And I appreciate it, Bill. Thank you so much for having us, and welcome everyone to this forum. Go ahead and get the share screen on here for everyone. Again, my name is Coartis Murkison, a hospital facility advocate, and I do have Mark McQuistion here with me today. I will have Mark to man the chat, as Bill stated. I will periodically take pause to see if we have any questions before moving on to specific topics.
We can see you. There you go.
Good deal. Thank you. Thank you. So today we're going to just give an overview and definitely update you on some things that we have going on over here at United Healthcare. Some of the agenda items for today is who we are, provider market operations. Some people still may refer to us as provider relations. It's still the same concept, but we do have that new name. We are now provider market operations. We'll review the Georgia service model and escalation process. Some of you who do billing should be familiar with this model and also that process, but I'll go into more detail about it. Talk about our United Healthcare Provider Portal. This was formerly known as Link. You may still hear us refer to it as Link because we're just in that habit of saying Link, but it is now called the United Healthcare Provider Portal. And then we'll end with some resources and training information for everyone. Just who we are. Again, we are Georgia Provider Market Operations. Some of you may know your advocates in Georgia. Hopefully, most of you do know your advocates, who they are. But our senior physician advocates, and these are the advocates that handle the physician groups. We have Salim Hudson, Mark McChristian, Allison Murray, and Tony Thurman. And then for our hospital and facility advocates, you have myself, Cordes Murkerson, and Kara Roberts. So these are the individuals that are on the Georgia Provider Market Operations team. We handle all claims related education, anything for the market for Georgia. We've gotten a lot of questions about exactly what it is we do, and we always want to clarify and just a reminder of what the Provider Market Operations team, and I do have on the screen network management. So I'll tell you what the difference in those two departments are. So on the left side, you have Provider Market Operations. Again, that's formerly known as Provider Relations. We do a lot of the education. We do have trainings that we offer. We can do those trainings for your groups or for your facilities if needed. We are the main point of contact for your claims concerns, meaning if you have claims questions or you have to follow up with any type of claim issues, that is directed to the Provider Market Operations team. Again, I'll go into detail about that service model. We provide a lot of education, as I mentioned, on general things about the provider market operations and what we have going on. We do always try to keep you abreast of any network news that United Healthcare has that's coming out, things that we want you to be abreast of. We do try to share that information with you and follow up with you as needed. We can initiate claims projects when identified by someone in your group. And again, I'll get into more detail with that when I go over that service model. And this applies to all of the participating providers. So any non-participating providers, we do ask that you go directly through the provider service department, which is a totally different department, and they can assist you. So on the right side, it's network management, our contracting team, and we do work very close with this team, but we always want to level set and let you know what the difference is. So if you have any questions on anything related to your contract, your rates, any type of negotiations, things, those will be directed to that network management or that contracting team. So that does not come over to the PMO team. It stays over with network management and that contracting team. Anything related to contract language, questions about fee schedules, any updates to your NPI numbers or your TINs, rate letters, this goes directly to your network management team or your contracting team. And hopefully everyone knows who those individuals are. You will have the network account managers, and then you also have your senior network account managers. So those are your NAMs and your SNAMs. So just a general overview of who Provider Market Operations is and who network management is, and the difference between what the two of us handle. Again, we do work closely with those individuals over in the contracting side, but we just always like for you to know exactly what the specific roles of each of those are. So I'll leave that up just for a second in case anyone wants to jot down the specific of the roles. So let's go and take a deeper dive into our Georgia service model and escalation process. So this is all of the claims related details or information. And we are part of a Southeast team, which consists of Georgia, North Carolina, and South Carolina. So we do have that Southeast team, but our umbrella is the East region. For any type of claim issues, and hopefully those that do billing and have had to outreach to your advocate, they have explained that service model to you. And so what the service model is it's a process that United Healthcare put into place to better streamline how we handle our claims issues. And I know we get a lot of questions as the advocates. Can I just send the issues over to you? Can I just send the issues over to you? And while we would love to take on all of those issues, there is just not enough of us to do that. So United Healthcare does have this designated team that can review the claims, and they can process and adjust those claims for you and also find root cause. So within that model, you have that claim issue. The first thing that we always ask that you do is go out to the United Healthcare Provider Portal. Again, that's formerly known as LINK. If you need a reconsideration done, you can go ahead and do that on the portal. Hopefully everyone that uses that portal has your login information, and any individual on your team that needs access, they have already gotten that access so that they're able themselves to submit those reconsiderations and also track anything that's going on with those particular claim issues. You are allowed to call into provider service to do the reconsideration, but we always advise you to more so do it on the portal. Submit everything via portal. So that way you don't have to spend as much time on hold. You will get a reference number when you submit your information via that provider portal. You are able to track your claims throughout the system. And there's another slide that gives more detailed information on that. It's just a little easier to submit that via that portal. So that way you feel as if you have ownership of the claims that you have submitted. The provider service number is on the screen in the middle. It's 877-842-3210. That number is always for any other specific provider service questions that you may have if you cannot get in touch with an advocate or you just need additional information in reference to provider relations as a whole. Now, if you submitted your claim through that first step by going to the provider portal or formerly known as LINK, and you still have not received, maybe you disagree with the resolution that was given to you, or you just need additional information, or you want to escalate your claim or claims to have them re-reviewed, you are allowed to do that. We do ask that you use a template that I'll show you. You have to place your claim, and you don't have, just say if you have 20 or 30 claims, if you've done a reconsideration on one of those claims and it is the exact same issue for all of the claims, you don't have to reconsider all of those claims one by one. Save that reference number that you've done on that first reconsideration, add it to the template and add those claims to the template. And then you can submit that information over to our RCM team, which is our Revenue Cycle Management team. That team will take those escalated claims, they will review those claims, make sure you put your comments on there, exactly what it is you want done with those claims. If you want those claims re-reviewed, or you don't agree with the denial, or if you need additional information, send it over to that team. And that their email address is southeastprteam@uhc.com. When you send information information over to the escalation team, make sure you CC your advocate on the email. So that way your advocate knows that, hey, my provider has done a reconsideration, they've submitted to escalation. And if your advocate needs to check on the accounts for you, they are able to do so if you CC them on there. If they need to follow up with that resolution team, they are able to do that as well. We do like to remind you, once you send that escalation over to that Southeast PR team, you will receive an automated response back. And that's just letting you know, hey, we've received your issue. We will review and get back to you. All of the responses will come back from that Southeast PR team, and they'll let you know where they are throughout that process of reviewing your claims. Again, so if you submitted the reconsideration on the United Healthcare Provider Portal or link, you still need additional assistance, or you want to escalate your claims, drop your claims to the claims template and send it over to the Southeast PR team and CC your advocate on that. And this is what the template looks like. The template has the yellow highlighted boxes. Make sure you complete all of those fields, because that is the information that that resolution team will need to review. If they need to submit a project for you, they can do that, but they need those highlighted fields completed. So the tax ID number is very important. Your reference number that shows them that you have already submitted a reconsideration. So make sure you keep that reference number and place that on the template as well. Mark, do we have any questions? It looks like I saw a couple hand raised. If you want to answer those questions for me.
No, we don't have any questions that's come in at the moment. I will direct everybody to what I put in the chat. Please disregard the first link, as that was the incorrect link I was trying to put up. The second link is a link to the portal training processes that they can do as a self-paced learning.
Okay, gotcha. I saw a hand, looked like two hand raised that came over on my end. If you are those individuals that raised your hand, go ahead and put your question in the chat so that Mark can answer it, and he'll answer those while I finish the presentation. Want to make sure that we have everything. And if you do have a question, again, place that in the chat, and Mark can let us know at our next pause. Thanks. So let's move on to the United Healthcare Provider Portal. Again, this portal was formerly called Link. And again, some of the collateral may still have Link on it. This name change is fairly new. Still the same process, still the platform. We just have an additional features that are on there and just some enhancements that they've done. So it is now the United Healthcare Provider Portal. And let's see exactly what the portal has to offer. Again, hopefully those that need to utilize the portal for anything, and it's not just claim issues. The provider portal has a lot of other resources that are out there for you. And hopefully everyone has had a chance to go out there to look. We do have an administrative guide. And our administrative guide is more so of the UHC Bible. It houses all of the information from claims information, rate information, authorization information, everything that we have or that we want to update. We put it in this administrative guide. That guide is fairly large, so I don't know if you want to print it out, but I always recommend and let individuals know that if they want that guide, go out to the portal and just save it onto your desktop. A lot of helpful information in there, and a lot of the information, most of the information will always be there, but we change it on a yearly basis. If there's anything that we need to add, we do so, but the meat of it will always be there on that guide. Again, that's out on the portal as well. So when you go into the United Healthcare Provider Portal, this is what it will look like. If you just go out to uhcprovider.com, you'll see it on the left-hand side at the bottom. there are a lot of different tiles, and we call them tiles, those the purple, the blue, the green, and then the darker shade of the blue or purple. There are a lot of different tiles that you can go and take a deeper dive into, which takes you to different outlets within that portal. So we have the claims and payments, eligibility, our policies and procedures and protocols. All of those are housed out there, and as they are updated, we try to keep that as up to date as possible. There is a separate team that works on making sure all of our policies and protocols are up to date. On the landing page, it will, if you see at the very top right-hand side on the left monitor, there is a sign in. If you already have your sign-in information and you do have an administrative login, you are able to log in to get a deeper dive into your facility or your physician information. And from there, you can log in if you need to submit those claims, if you need to do any type of authorization, or if you need to check benefits, you are able to do so. On the right side, there's just a deeper dive. Once you have already checked in, this person checked in as Elizabeth, it'll ask you on the left-hand side if there's anything you need to do to verify eligibility or benefits, you can do that. And then if you look to the far right-hand side, it says look up a claim or a ticket. And remember when I mentioned that reference number or your ticket number, make sure you always keep that when you submit any type of claim reconsideration or anything, because you can use that number to track, again, where you are in the process of where that claim or that reconsideration is. It easily allows you to do that. A deeper look at what the claims landing page looks like. So these features on this, once you're into that claim system, it does allow you again to view your claim status. You are able to access letters and remittance advices. You are able also to flag your claims. If you have certain claims that you're monitoring or you're watching, you are able to flag those claims, and you can come back and see those claims that you flagged and decide at the time if there's any type of action you need to take on those particular claims. So that's what that claims landing page looks like out there on the portal. So your eligibility and benefits, again, that's what it looks like. You need to just pop in that member ID or date of birth for that member. You can search it that way. And if you look on the left-hand side, that's blue, it says search for multiple members. You are able to search on multiple members as well. You will have to put a time frame in there. If you're looking for a particular member, you may not know exactly what date it was. You can put a date of service roughly in a start date of service and an end date of service, and it'll pull up all of those individuals within that time frame for you. You're also able to check to see if prior authorization is out there. You can do that by codes. It allows you to put in any type of code to see if there is any type of authorization that needs to be done. So again, a lot of these features have already been out there, but some of them are newer features that we have now that it is called the United Healthcare Provider Portal. More information on prior authorization. Again, if you submit those, you are able to check the status of it. You will get real-time information if you go ahead and submit it in there. There is a designated team that is behind the scenes pulling that information and will work and submit those authorizations for you. We do have a document vault, which I'll get into more detail about, which you are able to pull up letters from. Any of your letters will be housed in Document Vault. And again, I'll get into detail on another screen exactly what letters you're able to find out there in Document Vault. And that is one of the newer features that we have, which allows you to just go ahead and pull your information or pull any letters that you may need or you've been looking for. They should be housed out there in Document Vault. But again, I'll go through exactly what is housed out there for you. Your referrals can also be done online. If you need to look up any type of referrals, again, you always need that member ID number, that date of birth. You can go ahead and do that. You are able to view, print, or save any confirmation numbers for any referrals that have been printed. At the bottom, you can also see a referral or a member history of referrals that have been for certain members. Some of the providers like to have that information so that they know, but you can also do that. And towards the very bottom, again, it just shows you where it allows you to create a new referral. So just trying to make everything a little easier for you and access for everyone to get to submit everything so that you don't have to do the calling in or sending in, have it all housed at one place. And again, that is at uhcprovider.com on the portal. We do have Track It, which is a new solution that we have to track your claims. You look over to the left, Track It is there. You're able to see all of your tickets, anything that you've submitted. Again, you always have to log in to see your specific information. And it also will vary if you have a team of individuals on your team. I don't know if everyone will have that same access or same login information, but you will be able to see the information that you've submitted. You are able to view those prior authorizations, the cases that are under review. You'll also be able to see any closed cases that you've had and the resolution for those cases. We do ask that you go ahead and sign up for any emails if you want any type of notifications, or you're allowed to flag or just say, hey, I want to be notified when anything has changed on a submission that I've done. At the very bottom right, it says manage email notifications. You are allowed to go ahead and have notifications sent over to you when anything changes with the different claims that you've submitted or different authorization or anything that you submitted. You will receive a type of reminder or, hey, this is what's going on with that submission for you.
Coartis, I would
Yes.
like to take one moment now and address a question. We've had two different ones come in that are basically the same general question. And I think this is probably one that would be good for us to go ahead and ask. And it's around authorizations, and more specifically when they are going online through the portal to get an authorization or check on authorizations, and they're being told that authorizations are not required, and then later claim is being denied for an authorization. And I would say to those questions, the first thing you want to do is, if an authorization is not required when you go online, do a screenshot of that. When you do a reconsideration for that said claim that has denied for authorization when you're told it's not, include that screenshot as your documentation on your reconsideration.
Right.
And then at that point, once you've done the reconsideration, if it's still not addressed, then you will follow the escalation directions that Coartis gave you previously.
Right. And we've gotten that before, Mark, where we've had providers to say, and I know you heard it before, that expos where they say, okay, we were told, or it pulled up on the screen, it says no authorization is needed. Then come to find out you do need an authorization. As Mark recommended, take a screenshot of that. If it says no authorization, just take that screenshot and keep that, because that is your proof that the system said you do not need that. And that will always be the supporting documentation if you need to escalate it for any reason, to say, hey, I was told one was not needed. Here's that documentation. And individuals that are working that clinical team, they have to take that in consideration, and they will see that you were told no authorization is needed. But yes, as Mark said, do that screenshot so that way you have that for your reference and you can share when you do an escalation. Document Vault, I touched a little bit on it, but let's just take a deeper dive into Document Vault. It's one of our newer services that we do provide. We're trying to reduce the amount of paper that everyone has to use. So instead of just sending out a lot of letters, we are allowing the internal team to populate those documents in Document Vault for you. So you're able to go into Document Vault. You can view, download, and print any documents that you need. Again, if you need to flag a letter to come back to it, you're more than welcome to do that. The Document Vault information has the commercial Medicare, the Medicaid information if you have the community plan. We don't have that in Georgia, but some Georgia providers are at that line of other states where they do have the community plan, but we do not have that in Georgia. Those letters are on there. And then United Healthcare West member letters are on there. Payment documents for most of those plans will be housed in the Document Vault as well. And then most of the overpayment letters are also on Document Vault. Again, you will have to have your sign-in information to get your specific letters for your group or your facility, but it is out there for you to access. We will still mail some letters to you as needed. We do have that. Again, we're just trying to reduce the amount of paper that we send out and letters that we send out. So for your convenience, we are allowing you to have access to go in there and get those letters as those are needed. So just to reiterate those letters that are available. So if you look on the left-hand side, we have the United Healthcare commercial information. So under the claims information, the letters that are out there are acknowledgement letters, the claim reconsideration responses that will be, those letters will be out there. Under prior authorization, your approval letters and your denial letters will be out there, as well as any other letters asking or requesting additional information. Those letters will be out there. Overpayment documents, that information, those letters will be out there as well. So that is for the commercial side. And then on the Medicare side, so your claims letters, not as many of those letters are out there, but they will have the additional information needed, letters that are out there, reconsideration, and of course your balance billing letters would be housed out there. Same information for your prior authorization, that will be your denied, approved, and lack of information. We need additional information letters. And then your appeals and disputes, those letters will be out there stating if we do need additional information, the letter is out there, what the resolution may have been for an appeal that you submitted, and just notification acknowledgement that your appeal or other information has been received. That's the information at a glance of what's housed out there on the Document Vault for you. Mark, do we have any questions before we go on to the next area? Anything that you haven't addressed in the chat box?
Not at this moment.
Okay, we'll move on. So let's talk about some of the resources, some of the updates we want to share with you, and then end with some training information for you. We used to send out our network bulletin, or some of the advocates would send out a network bulletin to you, send out an email, and in the body of the email, it would be an overview of the network bulletin and then also a PDF version of that network bulletin for you. We no longer send out that PDF version of the network bulletin. What we're asking everyone to do is go out to uhcprovider.com and subscribe to the network bulletin or network news. That way, you can get all of the United Healthcare information sent directly to your email. So everything that some of the advocates used to send out in that network bulletin, it will come directly to you. You will be able to click on the different hyperlinks that may take you to some different news updates that we have, but it is the best way to stay abreast and aware of exactly what UHC is trying to share with you all, any updates that we have. It will come in the network news brief is what we call it. On the left-hand side, when you get it, that is what it looks like when it pops up. It will say network news brief. There is a team that works diligently to ensure that everything is up to date. Any type of change, policy change, we submit that out to you in that network news brief. Any type of national news that we have for UHC, we want you to be aware of. That information is out there. So please, if you have not done so, make sure you go out to sign up. Just put your information in there, have your team to do that as well, and they can get the network news information sent directly over to them. You all can receive that as well. So that's one of the features that we want you to be aware of. That's something that we've started doing since we no longer send out that hard copy or that PDF version of that network bulletin. So make sure you go out and subscribe and have everything to come over to you directly in an email. COVID information and resources. At uhcprovider.com, we do have a clinical team and individuals that only work on COVID-related questions and concerns. So if you go out to uhcprovider.com/COVID-19, they are constantly putting any type of updates out there, COVID-related out there for you. There's a section, if you even go to the homepage, on the landing homepage, there's a COVID section that has a lot of the questions that most providers have submitted, but we also have placed additional information out there on any updates that we receive. We always want you to be mindful that we are receiving the information. We receive a lot of information from CMS as well as our internal partners. So we try to make sure that everything is out there for you. We know there are a lot of questions, and over the past year, a lot of things have changed, but we are working diligently to ensure that that information is up to date. And again, there's a team of individuals that make sure those resources are up to date for you. Towards the bottom right, just an update. We did have a lot of questions about our COVID-19 codes that were being held. Related codes have been released, meaning the codes have been released. We've received a file from CMS, or we received a go-ahead from CMS. But we always like for you to just keep in mind, even though it says that the codes have been released, give us time and give the system time to make sure the platforms are uploaded, because there are different codes that are coming in that the internal team has to upload before the claims can even be reviewed and processed. So, it means that the claims are no longer in that hold pattern. We have the information from CMS that we need, allow us to upload that information onto our platforms, review, and do any type of modifications that need to be done. Then allow that standard time for those claims to process and for you to get those EOBs and PRAs on your end. So that's an update that we received from our internal team. But again, we do have the information out there at uhcprovider.com on that COVID side. You can click on there. We've had questions to come in from specific providers, and our internal team has provided answers. So they've placed those answers out there as well. And just in case anyone afterwards comes out and says, oh, I have a question about something, that answer may already be out there for you.
Corda, someone's asking if the COVID information includes HRSA claims that UHC is processing. Do you know if there's information in there on those?
There is, and Mark, I don't know if you can get it. I know HRSA, they have their own process that you have to outreach to them to get specific information about those particular claims. And Mark out if there's any way that you can check to see if it's still out there on our webpage or not. But I know we did send something out about that. And what I can do, Bill, is I'll make sure that when I send over this PowerPoint presentation, I will send that information over about HRSA so that you can have it and disseminate it to the group.
Okay.
Yep, because there's a totally different process and different individuals that the providers would need to outreach for that information on those claims.
Okay.
Just a clinical update for everyone. United Healthcare currently uses the Milliman guidelines, but we will be transitioning to INAQUAL criteria, and that is May 1st. For those that have already subscribed to the network news, this has been in that documentation for a couple months now, but I just wanted to make sure everyone is aware. We will be transitioning to the INAQUAL criteria, and that is May 1st. There is no type of disruption to any process that we have going on. We just want everyone to be aware of that. If you do have any questions, make sure you outreach to your advocate, or you can call the back of the member's card if you do have specific questions. But that's just an update. Want everyone to be aware. Starting May 1st, we will transition over to the INAQUAL criteria. We have a designated area at uhcprovider.com that's designated for training. There are some trainings that are pre-recorded, and then occasionally we will have live educator-led webinars or trainings that you all can attend. It is out there again. If you go out to uhcprovider.com/training, that information is out there. And I know some of you is like, no one has time for training, but we just want to let you know that that is available to you. You may have new individuals that join your team or new individuals that join your staff, and you want them to be aware of what the United Healthcare Provider Portal is all about. At their leisure, this can be some onboarding that you can provide to those or give those new staff members that join, so they can go out there, be familiar with what that provider portal looks like and the other features that are housed on that portal. So we have heard that some people do find it useful when they do have new team members to join their team, but we wanted to reiterate that that is something that is out there for you all if you need it. It's training specifically for you as our providers, and that is something that we wanted to offer for you. So it is out there. Again, if you want to go to uhcprovider.com/training, and it will navigate you to how to register or to find what trainings will be upcoming. We've received some questions about browser capability, and that may be across the spectrum. We are transitioning to using Microsoft Edge Chrome or Apple Safari. So we will transition on August 17th of this year from using Internet Explorer, and we will move to using more of the Microsoft online services like 365, OneDrive, Outlook, and a lot of the other services. So if you're one of those individuals that uses Internet Explorer and you try to access some of our information or hyperlinks or other resources on the provider portal, you may see that it does not work. Definitely after August 17th, it will not be functioning correctly. And for you to maximize what's out there and you to get direct access, if you want to use the browsers that are recommended on the screen, feel free to do so, but we just wanted everyone to know we will be transitioning from Internet Explorer to the other browsers. I know I tried a couple of times, and sometimes if you go and try to use Internet Explorer, it'll say maybe it's outdated and it recommends that you use another browser to do so. So that's just a heads up for everyone. We will transition and actually use other browser capabilities for our portal access. So that brings us to the end of the presentation. I'll go back to Mark to see if we have any questions. We'll open it up if anyone has any questions that have not been answered that have come through the chat. Anything? Bill, did you receive anything on your end?
Not anything that Mark didn't address or you didn't address. So Mark has done a nice job of answering some people's questions as you've gone along. So
that's why he's the co-pilot. He's good like
that. There you go. Yeah,
oh,
yeah.
And Bill, just to let you know, you do have this updated version of the PowerPoint, so you can disseminate it. And then I'll also get out to you the HRSA information that you can share with your participants and the attendees as well.
Yeah, that would be great. That would be great. We do have a question that came in here. It says we've had an overabundance of downcoded claims. What is UHC using to determine correct coding? We appeal the claim with medical records outlining the 3 major components, and denials are still upheld. Okay,
so that is more of a specific question. Whoever your advocate is, outreach to your advocate, and that advocate can assist you with getting those specific questions answered for you, but that is more of a specific question. I don't think that's something that's across the board that we've heard from all providers. So that would be more specific, and we do ask that you outreach to your advocate. If you try and you haven't gotten anywhere, please feel free to outreach to me, Cordis Merkerson, and my information will be on the presentation, and I can look into that for you.
We also have another question, Cordis. This one is asking for updates on the designated provider. I'm assuming this is discussion of the designated provider policy for the labs.
Right, and we do have.
I'm not definite.
It probably is, and I'm gonna write that down too, Bill, to give you. So I'll give you the HRSA information and then the designator information. I'll send that over to you because we do have that in a documentation that has specific contact information on there, and I'll send that over to you as well so that you can have it.
Not to be confused with Designated Survivor, which is one of the series that I binge watched during the pandemic.
Yeah. No, it's something different.
That's right. That's right. Thank you for that, Day. That's right.
And Bill, could you because I can't see the individual that asked that question about that, could you just maybe make me a note and send that information to me in case I need to get in contact with them directly? But I will send the information that you can give to all of the attendees, but I just wanted that particularly individual's information just in case I need to outreach to them, or if they had any particular questions, specific questions that they need to outreach to me for.
Okay.
Okay.
All right. I'm not seeing any more. Mark, are you? I think we got.
I think we've answered everything that's come in so far. If we have not answered one sufficiently, or definitely please, put it in again so that way we can make sure we do get you an answer.
Yes, please.
Yeah, for sure. And folks, I am certainly not the expert here, but I'm always happy to help put you in touch with the right people. My email information was provided on the registration information for this forum this week, so I'm always happy to help direct you to the right person. But like they said, they're making themselves available. So if there's anything that you need from them, please reach out, and I'm sure that they'll be glad to help you in any way that they can. Cordis, if you'll just give me back the screen real quick, or maybe.
Okay, I will do. And again, Bill, my information will be on there as well. If anyone needs to outreach to me directly, they can.
Yes, absolutely.
So, and just my takeaways, I'll send you over the HRSA information and as well as the designated information so that you can disseminate as needed.
Okay, good. Yep, okay. I'm just gonna
thank you all for having us. Thank you all.
Oh gosh, we really do appreciate it, and I just want to thank your organization for continuing to support Georgia HFMA and cooperate with us on these events. We've been doing them twice a year, but this is the second one that we've done virtually. So anyway.
It looks
So-
like you've had good attendance. Good.
Yeah, it's been pretty good. So what I'm showing you here, folks, is this is the homepage for the Georgia chapter of HFMA. I encourage you to go out here as well as to like the various social media pages. But for the presentations, what you'll do is you'll go out here to the media tab, and under media, you'll see document library. If you click on document library, that'll take you over to the different folders that we have set up. Go down to the in case you missed it section. Under 2021, you'll see the virtual payer forum for 2021. And all of the presentations so far this week are on there, as well as the link to YouTube for the recorded sessions. And I encourage you to take advantage of that or pass them along to somebody maybe who wasn't able to attend today. But I just want to thank everybody for their participation and for their support of Georgia HFMA. As I've said all along this week, you folks that are on the front line and following up on a lot of these claims, you're doing a very valuable service for your organizations. And I would tell you to just keep doing what you're doing. Don't be afraid to ask for help. Make sure you're taking advantage of all of the online tools that are available to you, in addition to the resources that have been assigned to your particular organization. It can certainly get frustrating at times, but I have found through talking with my peers and colleagues over the years that if you keep yourself up to date and informed about what's happening and some of the latest and greatest information, there's a certain value and power in information, right? The more information you have, the better off that you'll be. So I encourage you to try to be a student of some of this stuff with the payers and know that the information is available, but you need to hold them accountable and you need to hold them, make sure that they're not putting your organization in a difficult place by hanging on to revenue that is rightfully yours. And that's a general statement across all payers. Make sure that you're doing your part. So hang in there. Your work is greatly appreciated. And again, tomorrow we have Ambetter, which is now part of Centene and WellCare. Not sure exactly how they're going to split that presentation out with the different pieces, but they'll give us an update nonetheless, and certainly happy to answer any of your questions tomorrow as well. But we'll be back here again tomorrow at 1 o'clock for our next session. So with that being said, again, I just want to thank everybody for joining us today. We hope to see you at more Georgia HFMA events, and wish you all well. Stay well. Thank you.